Hi again, everyone. My name is Madlyn McAuliffe. I lead communications for NUMO, and I'm going to be moderating today's panel. I'd like to say, first of all, thank you and welcome to everyone joining us for the third webinar in our Resilience in Transportation series, Lesson from North America's Response to COVID-19. In this series, we'll be highlighting how cities around the world have responded to the global crisis, particularly how it has affected mobility, health, and safety. And we've invited experts to share lessons that they have learned so far, thoughts on how future resilience planning will be affected. And this series is co-hosted by NUMO, the New Urban Mobility Alliance, GIZ, TUMI, EUROCLIMA Plus, and the World Resources Institute Raw Center for Sustainable Cities. Today, we'll be hearing from Azhar Chougle. He is the Executive Director of Transit Alliance Miami, and from Mark de la Vergne, Chief of Mobility Innovation from the City of Detroit. We'll also hear from Álvaro Caviedes, an associate at Jarrett, Walker and Associates, about the state of mobility and transit in North America. As a note, we'll be doing a question and answer session at the end of the presentations, but please feel free to submit your questions via the questions feature here on the GoToWebinar platform. Thanks again for joining with us and for bearing with us during these technical difficulties. Seems to be just what everyone is going through these days. So let's kick things off. We'll be starting with Mark de la Vergne. Again, he is the Chief of Mobility Innovation for the City of Detroit. So Mark, I believe you are a presenter, if you'd like to start sharing your screen.
So good morning, everyone. Appreciate everybody making the time. I think these are three interesting different case studies. Also appreciate everyone's patience on technology. GoToWebinar provides its own set of challenges. I went through something similar my first time on it, so well prepared, but great presentation. So I'm gonna just briefly kind of give an overview on what we've been doing in Detroit. It's been a little bit unique, and it's been unique due to the circumstances here in the city. And sort of kind of talk about like why we chose the path that we did. As you may be aware, COVID hit Detroit really hard. These are our dashboards on our websites, and you can see sort of that first week of April, the number of positive cases and unfortunately the number of deaths were significantly high. And I think everybody in the city was touched, unfortunately, with people you knew either really going through or unfortunately passing away. It just came out of nowhere, just like everybody else, and just really hit this city really hard. The good news is that as hard as it hit, we've been able to sort of go down really quickly. And a lot of this is due to the mayor's leadership. And then a lot of it is just due to the community coming together and practicing social distancing and working together to get this out of our community. And from the start, so the mayor used to be a CEO of one of the hospital systems here in the city, so he's got a pretty strong background on this, and he saw that testing was the way that we were going to move out of this. So we set up in the city a really large testing site that's capable of doing about anywhere between 1,000 and 2,000 tests a day. We set it up in about a week in a large vacant site, and the mayor was pushing really hard to say, like, how do we make this available to everyone? So it's a drive-through testing site, and we quickly figured out that one of the challenges of a drive-through testing site is you have to have a car. And in a city where 25% of households don't have access to a vehicle, the idea that everyone was going to be able to drive there was just not realistic. And that first few weeks was a huge scramble for everybody in the city, working within their disciplines and sort of reacting to the situation and how it was impacting what they work on, but also collaborating across. And the biggest issue we faced in those first few weeks was making sure people were getting where they needed to go. and whether that was folks that needed to get to testing sites, the people that were working, make sure they got to work, but also we had a big focus on our homeless population to make sure that we were protecting those folks as well. So after about a week of having the testing site up and running, the mayor basically said, like, we need a transportation service to get folks to this site. We did not want people walking up because we were trying to limit exposure. So even though we have a good transit access to the site, we didn't, we basically said you can't take transit and walk up to the site. So what we did was basically spin up a transportation service so that when folks were booking their appointments, they could also book transportation at the same time. We did add a cost to of $2, which is the same as our bus fare, but we also made it pretty clear that if you don't have $2, you don't have to. We're not going to deny you a ride. We'll keep picking you up and we'll cover those $2. And, it's a pretty simple service, right? Like, you book the ride, people come and pick you up the next day, drive you through the testing site, and then drop you back off at your house or your residence. One of the big things that we were really concerned about was, making sure that everybody in that vehicle is safe. So we made sure to distribute PPE to everybody, and then making sure that the vehicles are sanitized. We have 2 cleaning sites up and running that's just for this service. So we dedicated a lot of resources to this, but we did it because we wanted to make sure everyone in the city has access to testing. So at this point, it started off, you needed a prescription. We made it so that you didn't need to go to a doctor for prescription, you could call a doctor. But this week we announced we've opened the testing site to anyone in the city. So if you want to get a test, you call the hotline, you can get a test, you can get an appointment. And if you want transportation, you can do the same. We've kind of continued to open it up, and testing is going to be obviously continue to be a big part of how we open the city up, and we want to make sure that everyone can get to it. As we were doing this, the thing that we heard loud and clear from the drivers of the service, which are taxi drivers and other transportation providers, was drivers being fearful of the lack of protection between the passenger and the driver. So I spent a lot of time just like calling people in the industry around here to talk through how do you sort of retrofit vehicles essentially for this type of service. We got connected with Honda, and we launched a pilot with them where they're providing 10 vehicles that have separation, 10 Honda Odysseys, separation between the front and back, as well as they've revised the air circulation to make sure that the driver and passenger are separated in that way. I think that this is as we start to open up sort of the idea of how we're providing transportation services when people are getting picked up. I think this is, social distancing in a vehicle is a challenge. And I'm hopeful this is one of those ways that we can do it. We're also got a partnership with Penske that we're doing something similar. So just trying to innovate around these types of services and seeing then how they're going to scale in the future. Again, like a lot of transit agencies, the safety of our operators became paramount. We probably should have reacted a little bit quicker with how we protect our operators. But once we sort of got that message, we basically said, like, we are going to do everything we can to protect you. And we've elevated, to make sure that we elevate our operators in sort of the same way that we've elevated our first responders and other essential employees. So, similar to other agencies, we turned the fare boxes off. We had passengers only use the rear door unless they had an accessibility need. Making sure that we're focusing on essential trips. We were one of the first agencies to make masks available. Again, our team here has just been sort of laser focused on PPE and testing. So, we made sure to get a lot of masks, and we continue to do so to make sure that we have those available. So we created a safer trip experience. But at the same time, it's challenging for folks that do need to take the bus because of the limited capacity on the buses themselves. And we've been working with some employers to talk to people that are relying on transit still. And it can be frustrating, right, when the bus passes you up because there's not any room on the bus and not knowing when that next bus is coming. So what we've been trying to do is basically support two programs, and these are on the way. Hopefully will be launched very soon. But one is sort of an on-demand transportation support, and the idea isn't to sort of provide this all the time, but when you're in an emergency need, particularly when the bus passes you up, how can we make sure that we can get you a ride so you're on time from work? So I think we're going to probably pilot this with a few employers and then see how we can potentially scale this and complement with as we would increase our service from Saturday service to a more normal service pattern, knowing that still the capacity on the bus is going to be the limiting factor. And on some of our popular routes, we're going to keep needing to add some more buses to make sure that we're matching supply and demand, but there's still going to be some cases where people are going to need another option. So we're hopefully going to be launching that shortly. And then the other piece is a sort of a micromobility support. And this is a pilot that we had been working with NUMO to actually launch this summer, which was going to more focus on a different need. It was going to be focusing on folks returning to the workforce and saying, if we give you an e-bike or an e-scooter, is this a more reliable way to transportation? But because of the crisis that we've seen, we're pivoting it to sort of begin to focus around essential employers and probably expanding it a little bit more to the original use case. But in this time where transit's much more limited than it was pre-COVID, saying if we give you one of these vehicles, is it a more reliable option for you, number one, and two, does this begin to say like we can really start to introduce the conversation of expanding the number of options available here in the city. So we've learned some lessons obviously here. Some of them probably in the back of our mind, but really sort of crystallizes them. And one of them was really just focusing on what the problems people were facing. A lot of cities have taken different, and I think we'll hear about some of those different approaches to this. But for us, getting folks where they needed to go was the number one thing we needed to focus on. We're looking into, similar to what other cities are doing around closing streets and creating more public space, but that's more on how we open the city up. That was not our number one problem. Our problem was making sure we get people there. You also sort of need to, in a crisis like this, be able to get a lot of things ready, knowing some things might not happen. We built a lot of different ideas because those first few days it was just so reactive that we needed to sort of start thinking through, knowing that some of these things were going to begin to pop up and sort of elevate up to a mayoral level, make sure there's solutions ready. And the other thing is like, even though we're mobility innovation, like we're running a taxi service, like that's our big project. And it's not like we're reinventing anything that's out there. So, really relying on tried and trues and just making sure that, we're thinking through all the steps of the service, but it doesn't need to be the shiniest object. It's just an object that works. So that's where we are. Looking forward to the conversation coming up.
Thank you so much, Mark. That was a wonderful presentation. It's so great to hear what is going on in Detroit and what the city has really been working towards to facilitate mobility for essential workers, for everyone really. Next up, we're going to hear from Azhar Chougle. He is the Executive Director of Transit Alliance Miami. So Azhar, if you would like to share your screen, you can begin presenting.
Thanks so much for having me. My name is Az. I'm the director of Transit Alliance. It's wonderful to not be able to necessarily see you all, but have you all here. I'd like to start with something that you're probably looking at and wondering what the hell is going on. And I'd like you to ask yourself a question. What do you think is actually going on? Why does this bike rack have a garbage bag on top of it with caution tape wrapped all around it? And I've included for you a wonderful postcard of welcome to Miami. I'll explain as we go along, but this is sort of where I wanted to start off to get you thinking about the weird and wonderful world of Miami that you're about to enter. So the story I'd like to tell today is Miami and the pandemic, mobility and resilience in times of panic, and a little bit about Miami for those who haven't been here, but also in the context of all the crazy stuff that's happening right now. So the first thing you should know is we have a very vulnerable economy. if you look at the way that our economy is sort of divided into sectors, it's pretty much one of the worst economies that you could have during a pandemic, given that we have so much of our economy dependent on accommodation and food services, retail trade. It really has been a really hard hit for us, given the sort of economy that we have. And mobility plays a really, really crucial role within this sort of economy on a day-to-day basis. So in a pandemic, it only becomes even more important. So we get 24.2 million annual visitors here in Miami. So not only do we have a very vulnerable economy, a lot of our movement is dependent on people getting in and out of our city. So our airports, our roads, our transit system, even down to micromobility, where a lot of our visitors sort of depend on being able to move around and experience the city. So that's the second thing that's really affecting us. And the third thing, which has always affected us, but is now sort of being compounded by all of this economic distress, is that we've always had pretty poor job access on transit. So we're down in the 94 when it comes to our transit system's ability to give people access to opportunity. So these are the sort of three things that I want you to know about Miami. Also, it's a very wonderful place and I love it very much, but these are the three things that within the context of this pandemic and within the context of resilience and mobility that you really should know about Miami. Our resilience also takes on a few different forms, given that we're Miami, I guess. One, of course, we have the challenges of sea level rise, just constantly knocking at our door. We also have a storm season every year, and it's starting right now on June 1st. And also, we are a generally car-dependent, crazy place, which means our resilience takes on many different forms and many different challenges. And mobility plays such a large role because it's probably the biggest single thing that we are trying to do as a community, but not doing very well. I'll explain that in a second, to sort of abut all of the sort of impacts that we face as a community on a day-to-day basis when it comes to resilience. So why are we even talking about Miami in the first place? You might be wondering, because this whole webinar was titled Lessons from North America, which there will be some, but not many. The interesting thing about Miami and the interesting thing about talking about it is there's generally lots of problems and there's generally lots to fix. So there's lots of lessons as people try different things to fix them and do either very well or very poorly. And you're probably wondering, who are you anyway to even be talking about this stuff? So I'm the director of Translines. Like I said, but you should know that we are an advocacy organization. And for any of you who are scared of advocates or think that we have this alter perspective, you should probably take that bias into account. So we're an organization advocating for walkable streets, bikeable neighborhoods, better public transit in Miami. We're the largest organization of our kind in the Southeast. And as we sort of dig into the real meat of this, I've sort of divided it up into a few topics that you might find interesting. So one, critical services, transit, bikes and scooters, and streets. As I said, the lessons in this presentation will sort of fluctuate. We might find a few in the beginning, and then we'll have this huge dip and decline. And then towards the end, maybe we'll find something interesting, because I don't think North America is necessarily the best place in terms of how they've responded to this crisis. So let's start with critical services. Álvaro, actually, who you're going to hear from, helped us make this map at Jarrett, Walker and Associates of areas that have a high poverty and zero vehicle density. So I'm going to zoom in on a portion there so you can see it sort of up close. So those areas in red have a very high concentration of households that don't have a car and households that are in poverty. And unfortunately, like most other North American cities, coronavirus testing has sort of been focused on drive-up testing, which has meant there's been low uptake and also a lot of communities that have been left behind. So something that we started advocating for right from the beginning is walk-up testing. Here's our Miami Beach Mayor, Dan Gelberg, getting tested at the second walk-up testing site in Miami. But you know, the weird part is I'm from India, and in India, this very early in the pandemic started to become very, very normalized. And it's interesting how in a lot of our North American cities, this is something to advocate for, whereas in a lot of places around the world, India, South Korea is a great example, this is sort of default. Food access has also been really challenging without a car. And I'm bringing up these topics because as transportation professionals, we need to start thinking about how mobility starts to impact each and every one of these things. It's not just about connecting people to jobs anymore. It's about so much more. And food access has generally also been drive up. And so Commissioner Higgins here led the first sort of food distribution for people without vehicles. But again, where I'm from in India, this is a very, very normal thing. It's not something to advocate for. It's actually simpler to have people do food distributions in person, social distancing, rather than have them snake up in cars for 3 to 4 miles. So this is again, it's a very oddity about how North America's approach needs to sort of go back to the basics very often. let's talk about transit for a second. And Mark already went over some of the things that I think a lot of agencies are facing in common and actually responding very well on. So this weird situation we have where transit is empty and full at the same time, right? A lot of routes that, of course, are sort of barren, but a lot of routes where we have essential workers that are just overcrowded and that we're having to deal with in different ways. Like a lot of places in North America, Miami has a lot of transit commuters who are essential workers. In our case, 36%. Protecting transit workers has been a huge challenge here and in a lot of other places. Here, we actually have the transit union suing Miami-Dade County for more masks and hand sanitizer. But at the same time, just like Mark said, there have been some really quick actions in North American agencies that I think are worth commending. For example, here, suspended fares, your boarding, masks required. All of the communication came pretty late. But I think North American agencies have been very quick to sort of adapt to the sort of safety measures that have been sort of required for riders. We did have day one of our partial reopening, and our trains are still empty. And I think that it just goes to show that as cities, we're really not going to know the full impacts of how to respond and what to do as sort of cities start to reopen, how many people will come back to transit and how to keep them safe. I think it's going to be a further evolving conversation. So the lessons from North America, other than the major pandemic bus network redesigns, which I think Álvaro will speak about, which are, I think, incredible. We don't really know yet what our general lessons will be from us as North Americans. But there's some really cool things happening in other cities, right? All of you people, I'm saying you people, I don't know who you are, but all of you people who care about autonomous vehicles, where are all the autonomous cleaning robots? Like, come on, like you guys should go crazy on this stuff. We're obviously not going to get to the point where we start to do temperature checks in the subway. Maybe we would, but really these are the sort of things where you look at other cities, they're like, yeah, they're really being a bit more proactive. And Detroit's doing a good job with masks. We're not, but none of us are doing as good of a job as Izmir, where you have mask-matic vending machines for riders. So really cool stuff happening in other cities that I think North America needs to learn from. Let's talk about bikes and scooters. And remember when I talked about that lessons from North America graph just dipping into a hellhole? Like, this is where we get there. This is that picture, by the way. For some reason, Miami is the only place where bike racks have been banned as a response to the pandemic. It makes absolutely no sense. Not only that, we're also one of the few places to actually ban shared bikes and scooters. This is not a lesson. This is more of a caution. Please, if anyone isn't, do not do this in your cities. It's been absolutely senseless. The thing that Miami is good for is we can provide experimentations in what not to do. And this is definitely something that's what not to do. We've had a huge surge in cycling like a lot of other places. People who feel streets are safe for the first time. So the lesson from Miami, don't even try and learn from us in this instance. We do some other cool stuff, which we'll get to, but this one, just close your ears. Do me a favor. Please take a screenshot of this picture right now and tweet it saying, and you can say whatever you want, but I would recommend something like bike racks banned during coronavirus, hashtag only in Miami via @TransitMIA. There's 193 of you. If I don't get at least 50 tweets, I will be very sad, because we're all part of the solution here, and you're part of the solution for making sure that this doesn't happen, not only in Miami, but in any other city around the world. So take a screenshot. I'll give you a second, tweet it out. I'd really love to hear from you. So let's talk about streets, my last sort of topic. This is how every North American probably feels right now when they go out into some of their streets. They're safe widely for the first time because of traffic declines. It's funny how, especially in Miami, we're all starting to realize, oh, look, the streets, I can walk, bike, oh my God, amazing. Who's been using all of this stuff all of this time? It's fantastic how North American cities are finally realizing this sort of stuff. Here in Miami, as an advocacy organization, remember, we successfully closed down what you might know as one of our most iconic streets, Ocean Drive, and now we are going to have a citywide program in Miami Beach, in the city of Miami, an unincorporated day to close down a lot of streets to give them over to distancing and to give them over to outdoor seating, which is a trend that has, I think, started in Tampa, Cincinnati, spreading nationwide, which I think is fantastic and wonderful, and really should be sort of one of the best things that's come out of this crisis. And I know there's a lot of very bad things, but this is one of the strange, wonderful things. Getting a bike is also taking a really long time, which really shows you how incredible this time is and what an opportunity it is to reshape our streets and our cities towards something much more sustainable. I just want to end with, this is a street in Miami right now where it's just this wonderful vision of how we can re-architect our cities to be so much more resilient and so much more sustainable moving forward. And it's on us to sort of make sure that we don't miss this opportunity to do that. So thank you very much. Really appreciate being here. I hope that was helpful. That's our website. You can follow us at TransitMIA, and I'll hand it over back to Leanne and the team.
Thank you so much, Az. That was a fantastic presentation. Also, so great to hear about what is going on in Miami. Although, some of what has been going on has been very sad in terms of mobility. Again, we will be doing Q&A after all of the presentations. We have one more presenter, so please welcome Álvaro Caviedes. He is an associate for Jarrett, Walker and Associates.
So yeah, thanks for the introduction. I work for Jarrett, Walker and Associates. The core of the work we do is basically helping cities and regions rethink the way they design the networks, and we also provide them with the tools they can use to communicate these networks to the community. So like within this context, this is what I'm going to talk about today, just transit during the pandemic. So for a little bit of context, ridership has abruptly declined in the US. Like the last data sources are showing that on average 70% of the ridership has declined. There are some agencies that are even seeing a worse decline, like the transit agency in New York is experiencing a 90% decline in their subway ridership. Other big subways, other big bus system networks are also seeing like a 30% decline. And this has led them to cut their service at range within 10 and 40%. And this is very problematic for two main reasons. So for the you who don't know about this, the transit service in the US is subsidized by the government, and the money comes from two pockets of money. So the first pocket is fare revenue, and since ridership has declined, all this money is virtually gone. The second pocket of money is tax revenue. So this can be sales taxes or payroll taxes. But as we know, the economic slowdown has decreased the people who are working. A lot of people have been laid off, so people cannot go shopping, and even some local agencies don't have the means to tax all the online shopping people are doing now. So this is extremely concerning because basically all the sources of money and funding that agencies have are basically gone. But we still need public transport. We see now that public transport is playing a fundamental role in cities. They are providing a network, a useful network to essential workers that is basically keeping the cities running. So how are cities in the US responding? First of all, they are cutting service. They are cutting service mainly because of two reasons. The first one is to save money. So the federal government in the US has provided a $25 billion emergency fund to transit agencies. And this is going to keep the lights on for a little bit, but not for a long time. We don't know for how long this pandemic is going to drag on, and this money won't be enough. So they're starting to save this money, thinking about the future. They're starting to think about how to recover when the ridership starts to gradually come back. The second thing is staff availability. So drivers are not showing up to work. They are sick already, or they are afraid of getting sick. And the agencies are not laying them off because we do need the drivers when the demand starts to come back. So then the question we need to ask is how to cut the service that minimizes the damage. And there are some interesting things cities are doing. I just want to point out that this is happening very quick. So all these solutions are very quick, and there hasn't been a lot of time to think about it. So the first thing, so we can split these two strategies in two. Like the easy strategies cities and transit agencies are implementing, and the tough decisions they have to take. So for the easy ones, cities are cutting service in tourism and recreation services. So the market for this type of service is basically gone. So for example, in San Francisco, they have these cute cable cars that is just basically for tourists, but they don't provide any useful service for the resident. So the city and the agency is saving a lot of money cutting this type of services. The second thing is the additional rush hour service. So I just want to point out that essential worker demand is happening throughout the whole day, not only rush hour. So rush hour is driven basically by the 5 to 9 worker demand. And this is a very expensive service to provide. But since all these workers, all these 5 to 9 workers, and all the students are now at home, the transit agencies are saving this money. And the third thing cities, like easy things cities are doing, is repurposing vehicles. So in the US, the main driver of the cost is the labor. So for them, it's not that much expensive to go from a small bus to a larger bus. So they're starting to do this in order to meet all the physical distance guidelines. And other cities, for example, like San Antonio, are doing interesting things like using some of the vehicles that are not running in routes. They're using them now as Wi-Fi hotspots in areas that do not have any internet access, or they're using some buses as like just to help deliver food and help the food banks in the city. But then these are like the easy things to do. Then we have to make the tough decisions, and this requires time. But as you know, we don't have any time to think about it, so it's a little bit problematic. So the first thing to do, like the thing that cities are doing, is cutting frequencies. This is dangerous. Going down to 15 minutes frequency in main corridors makes sense. But when you start to go from 15 to 30 minutes to 30 minutes to 60 minutes, the connections on which your transit network rely stop working. So now people have to wait longer times for the bus. And sometimes it just doesn't even make sense to take the trip because it takes so long. Other strategies cities are doing is starting to use the weekend schedule, using it during the week. This makes sense in some cities. For example, in Houston, we work with them designing a network that provided the same level of service during the week and during the weekend. So for them, going to the Saturday makes sense because they are still providing a useful service for essential workers. But other agencies, and this is mostly all the agencies in the US, there is like an abrupt difference between week and weekend service. So when they just jump to Sunday service to provide during the week, there is not good usefulness for people. So now trips are taking longer. The other thing cities are doing is to abandon service in some areas in order to prioritize just essential places, such as a medical center. But there is another problem here. So people who go to these places, such as nurses, janitors who take the transit, the public transport, they are coming from everywhere. So they need a minimal and functional network so they can go there. One thing we're telling cities and agencies is to think about where are all the people located who have an income that matches the income of a typical essential worker. And all these areas, we need to provide a minimal and functional network. And the third thing agencies are doing is cutting the duration of the service. So this means cutting service at night, and this is especially problematic too because in the 24/7 medical world, people are traveling anytime during the day. So when we're cutting service at night, we're basically abandoning these people and leaving them without any option to move. Another strategy, this is very interesting, is increasing walking distance. So on the map of the left, this is the San Francisco network. On the left, you can see the network before the pandemic, and on the right during the pandemic. So what they did is basically they have a grid of routes every other kilometer, and what they did was just turning off every other route. So they're asking people to walk longer. But what they did is very interesting is they're putting more frequency, more buses on the routes they kept. So they are providing more frequency. So people are taking longer to walk, but now when they walk, they are waiting less time for the bus because there is one coming on average every 5 minutes. So what is transit for? So this is a conversation we are having a lot with transit agencies. We're trying to change the narrative of what is public transport in our cities. And this is a problematic narrative because normally for people who are not like expert or are not in the field of public transport, they want the network to do everything at the same time. But public transport has different conflicting goals. So it can run like a business, like on the map on the left, where you have all your vehicles running on main corridors, or you can meet goals and just run your service in all the streets. So providing like enough service so people can use it, but not good enough. So when normally we ask like transit and we measure the success of transit of their own ridership, we want the buses to be full. But this is an unfair goal because transit is doing more than that. Transit it has a public responsibility with the community. And this is what we're seeing now. We have to provide a functional network to all the essential workers. And it brings me to my next point. So who is transit dependent? Normally, when we talk about this term, we just imagine these people that require our help and we just need to help them. But it turns out that we are all transit dependent now because we depend on these people to do their work, their essential work. So we need to provide a functional service. And all these people have always been there using our network, but now they are more visible. And now they're like showing the main objective, one of the main objectives of public transport. And I want to end with this. There is no a better moment to change. In the work that I do, we normally provide network alternatives for cities. And people, sometimes they're very hesitant about the change because they feel they are entitled to keep the things as they were before. But since everybody's habits and life has been disrupted, it's going to be easier to make these changes. For example, cities are starting to think about finding other funding ways to fund transport. Instead of having a volatile source like sales taxes or fares, they are starting to think about congestion pricing, for example. So I just want to close with this idea that all the demand and all the world that we had before the pandemic is changing and it's going to look very different in the future. All the mobility needs are going to change, and this is a good opportunity to build this future that we are going to start recovering after the pandemic.
Thank you so much, Álvaro. A wonderful presentation. Something that I personally have seen in all three of the presentations offered by our panelists today is how much access and equity have been affected by this particular crisis. So we're going to move over to the question and answer portion of the presentation today. And we are going to start with a question for Mark from New York City. This asker is wondering if you could explain a little more about the measure involving giving health and essential workers scooters and electric bikes. Specifically, will users be charged? Can they park it anywhere? Does this include electric bikes? And I mentioned electric bikes because total transparency, NUMO was actually involved in this effort. So Mark, if you could provide an answer for that.
Sure. So we're focusing in on the folks that are relying on transit. So right now these are for the most part lower income individuals who are relying and sort of are having monstrous commutes now just to get a few miles. So it's we're enrolling them. It's not like we're just sort of handing it off. Like we have a full enrollment process to make sure that they're fitting within that criteria. So it's going to be e-scooters and e-bikes. The e-scooters are being provided by Spin, and the e-bikes are being provided by GM's e-bike group. And it's 200 vehicles of each. And so the employers that we've been working with the employers and the HR folks and at the employers, so that we can kind of make sure it's really coordinated and sort of we have the parking. We're going to be providing the helmets. It's going to be a full sort of make it as easy as possible for the people that are going to be part of it. So we'll be providing everything to them. There's a very small fee. It's a $10 registration fee. We found with a lot of our pilots that there does need to be a little bit of a fee involved because free makes it much harder to evaluate sort of what's the future business case for this project. And that's, while there is an immediate need to say, how do we get people there? We also want to build this into a bigger project, right? To say, like, is this something that we can think through of how we might scale in the future to support folks that need to get to work.
Fantastic. We also have a question for Mark and Az. Have you or partners been able to incorporate resilience lessons in city or MPO long-range multimodal planning? Az, perhaps if you would like to answer first.
Yeah, I think in Miami, and the interesting thing about resiliency is we have a resiliency plan called Resilient 305. And I think instead of really incorporating as many lessons, I think what it's done is actually heighten the importance of actually delivering on a lot of the action items in that resiliency plan. I think that largely the modifications that are being shaped are really around things that I think a lot of cities haven't really experienced before or never planned. But when it comes to mobility especially, I think what we're learning is that if a lot of things in our resiliency strategy were already implemented or we're already moving in that sort of direction, we wouldn't be dealing with as bad of a fallout in mobility as we would be right now. So I think for us, the experience has been the opposite. It's been like it's only reinforced how much more important those plans are to implement rather than make major modification.
Absolutely, thank you. Mark?
Yeah, I mean, you know, the last 6 years in Detroit have been about building, right? Because the city, you know, was going through pretty much the worst, right? So, you know, we've this crisis sort of just really exposed, you know, the challenges that, you know, we knew existed, but really sort of brought them to the forefront for everyone, and not just in mobility, but across the board. I think that, yeah, I mean, I've talked to my MPO a few times, but it hasn't they have not really been sort of intimately involved. I mean, this has been really sort of reactive actionary. But I think it does begin to prove some lessons of you know what we are going to continue to need to support our residents.
Great. We have a question from John Paul Bender. From an operational expense sustainability perspective, what type of innovations are being considered in Detroit and Miami specifically, and considering the unknowns of how much of the pre-COVID ridership will return and how fast they will return? So perhaps if maybe Az first, if you could talk about the sustainability perspective and what kinds of innovations are being offered to amp up ridership, but also to increase access.
Yeah, JP, good to hear from you. So I think the first thing that I would probably bring to the fore here is that how Miami dealt with its overnight bus routes. And Miami has a few bus routes that run 24 hours a day, and instead of having overnight service on them, riders can now request an Uber or a Lyft ride to go along those sort of routes, rather than have to wait for an overnight bus that is usually running every hour. I can't say that I've seen data to really have a conclusive opinion on how that's worked out or not, because I can see it going both ways. But I think that's the most novel thing that we have done that I think is worth sharing, at least as an idea, even if it's not completely been validated yet.
Yeah, I mean, again, like it's what we're probably going to do is, you know, we snapped one way, right, to go to Saturday service. We'll probably snap the other way and just go back to some sort of level of full service, and then figure out like what sort of falls, what's the right level of service, because I don't think anyone, and I think Álvaro can probably talk to this as well, none of us know what like the next year and a half of transit ridership is going to look like, right? Like who's going to get on the bus and who isn't going to be riding anymore. So, you know, I think that we're going to have to keep figuring out like how we provide a level of service that works, and then, you know, how do we use innovation to potentially fill in some of those gaps. So it's a big unknown. I think the big thing is like ridership is not necessarily the metric, right? I think I was listening to Álvaro's boss talk yesterday, and that was kind of one of the things that he was pushing out there. But I think for us, you know, while we might not be focused on ridership, we are going to be focused on making sure like operationally we're running really well, and we are coming up with solutions to figure out some of those other cases that you know, make sure that people can get where they need to go.
Absolutely. Álvaro, perhaps you would like to speak on this topic as well about, you know, what types of innovations are being considered around North America for increasing access and also health and safety for travelers using transit.
So yeah, so I just want to point out again that during this time, we should measure ridership, measure transit success, not just in ridership, as Mark was mentioning, but accessibility to like essential workers. So we have been working with Memphis, for example. They had a long-term range plan. They want to get there, but since the pandemic, it's difficult to them to just go to that idea of a network. So what we're working with them is basically designing a network that is in the middle, that is providing a functional network to the essential workers right now, but it's going to help them recovering after the pandemic, so they know which are the main corridors that need to have more buses and more frequency. And this is the plan we have for them right now. The other thing that is very interesting that I have seen in San Francisco is that so normally transit operations are measured by reliability. This is measured by basically if the bus is on time at the time it's supposed to be. The problem with this is that if the bus is late for 5 minutes, this is considered to be on time. And this works from the operation side, but from the user side, this doesn't make a lot of sense because 5 minutes means waiting 5 more minutes. And if all the buses are within this range, they can wait at like almost the double of the average waiting time. So what San Francisco is doing is kind of leaving behind this measure of on-time performance, and they are starting to measure the success of their operations with headway control. They're making sure that all the buses are meeting the 10-minute headway they're promising, and this is what really has an impact on people and accessibility in the whole city.
Yeah, I think that the big thing, and this comes from Stacey Madlyn on my team, who sort of wrote a whole white paper. She hasn't released it yet. I don't like what transit agencies can do, but it's being sort of creating your culture of being willing to try something, right? Like we're in a place of complete unknown, and it's going to be different for everyone. So while yeah, I mean, you can sort of point to different places and say we're gonna replicate that. Being able to sort of from a leadership and then sort of empowering staff to say like give us an idea of what you might work and let's try this out. And you know you're going into an unknown, so you're going to have some fear there of saying like we're going to try something new, and you know it might not work, we might have backlash, but you know if you're going to do innovation, you've got to feel empowered to do so, and it's got to come from leadership on down. And I think San Francisco is a great example that they've been willing to try some things, and then they've sort of, you know, they try it, they learn, and then they do something new. And that's the process that we try and do as well. And it's different, you know, from a lot of transit agencies that, you know, are just basically focusing on like, let's just get the bus out, and we'll get the bus out in the morning, and then and in the evening we're done. And it's scary.
Absolutely, yeah. It seems like this is certainly a time where innovation is something we should absolutely consider and we should really jump on. And we've been seeing a lot of, as the three of you know, as most of us on this webinar know, a lot of public-private people partnerships as well, those P3s arising for and from this particular moment. We have a general question for all three of you. Are you aware of any research looking into behavior change of transit commuters? Let's start perhaps with Álvaro.
So I haven't seen any study. I have only seen like big companies trying like working from home for their employees, and they like that. They are seeing that people are still productive, and they have even asked people that if they want to work from home after the pandemic and the lockdown, they can still do it. So I do see that there is going to be especially a change in demand during the rush hour. And it's going to be extremely helpful for transit agencies because they spend a lot of money on this just rush hour service that just serves this for 1 hour, this amount of people. But if these people are just staying at home and working from home some day of the week, all these fundings and resources can go to a service that can work throughout the whole day for more people.
Sure, thank you. Az?
I think that, like Álvaro, I haven't seen any wide-scale studies, but even the initial sort of measurements coming out, I think the best example I've seen is Transit app and their demand measurements in terms of how they see sort of demand shifting. Even right now, I'm curious to see, like, over time. It's funny, as advocates, we always struggle to explain to elected leaders and politicians on how transit really should be an all-day service, and transit is not just about the peaks in the rush hour. And it's really now that people are starting to have this broad scale consciousness of how much transit should be doing right now and really needs to, and how that needs to carry over into the future. So like Álvaro was saying about working from home, for example, I think we might see entirely different trends in how people start to really see and consider transit as an all-day service, rather than, I think in North America, we tend to really focus on the peaks unfairly to the detriment of the entire system.
Absolutely. Mark?
No, and I mean, if any academic emailed me over the last 2 months, I would pretty much just delete their email, right? Because it was just like, it wasn't the right time to do that. And I think now is a good time because, you know, you're going to start to see opening up, and you're going to start to see more people out there. But, you know, we could be back in the same place in December, right? When a sort of the flu season comes and this becomes the peak, and, you know, we might have to go through this whole, you know, we might sort of start opening and doing more, and then have to snap back. So, I mean, I think this is a good time to sort of start to collate best practices and prepare, because we're far from out of this, and we could really sort of hit something hard again.
Yeah, and I want to mention too that it's very challenging for agencies to rely on data right now. The first thing is that data comes from fare box collection, and people, of course, are not paying. And the second thing is they collect data from APC. This is when you get on the bus or you just get off the bus, it counts you as a passenger, but this takes time to process and analyze. So all this just takes time, like agencies do not have, and they have to see better practices and kind of come up with ideas, understanding the city and where things are happening. They also are starting to rely a lot on their drivers. So for example, some routes that the drivers are starting to see crowded buses, they're just calling the dispatcher and they just send a bus to that route. So it can help people waiting in the bus getting in one without getting crowded. So I think this is a good opportunity, but there's not too much time to think about analyzing deep data because the decisions have to be taken now. So a better approach is to understand what is on the street right now.
I'm just gonna cut you guys here for a second. Sebastian with NUMO, because I particularly found this question interesting to some of the work we're currently doing. So I just wanted to shamelessly plug that into here. So we are actually, you know, we asked ourselves that question too, and we said, you know, there are so many data points and new data that cities do have access to right now. And I think even, you know, as Mark, cities really don't have the time right now to be thinking about this, but all that data is out there, and this is data that a lot of people might be interested in. So just, you know, a couple of things we're currently doing with some of this data is, you know, it's interesting to us. And I think, you know, as you were mentioning Miami's way of doing things, but, you know, some other cities have definitely taken, you know, a very different approach to all these new mobility modes. So it's interesting to us, and it's something that we are doing with help from some of these companies that are still operating, scooter and bike companies are still operating. We're looking at, you know, how the usage of those vehicles has changed before, during, and hopefully, you know, we'll continue to get some data to look at how the usage has changed after the pandemic. So, you know, we'll publish this at some point, but honestly, at this point for us, it's really trying to get a better sense of, you know, are these modes really adding into cities' goals, or are actually people not using them in a way that would, you know, add to cities' goals? So it's, I guess, still an open question, but there's something that, you know, I just wanted everyone to be aware that we were doing, and happy to connect with any of you if you're interested in some of this work.
Thank you so much, Sebastian. I think we have time for one last question, and it's for all three of you, and perhaps we'll start with Mark this time. Is there any chance, and this question, by the way, is from Chris Moon from the World Resources Institute. Hey there, Chris, thanks for joining. Is there any chance that this pandemic will provide an opportunity to change the narrative on active and safe transit for vulnerable road users anywhere in the US, in cities across the nation, but also maybe in Canada, the rest of North America? Will this move the needle towards less car dependency? So, Mark, if you would like to start.
So I'm going to talk about just from the Detroit perspective. I think it's really hard for me personally to sort of think of like the pandemic that's claimed so many lives is just an opportunity, right? Like, because it's just it's hit here so hard that, you know, yes, it's going to sort of affect change in a big way here in the city, and the city is going to be different. You know, we you know, I think for us, it hasn't necessarily said like this is how streets can be used. It's more of like here's like the vulnerabilities that essentially exist in the city that we continue need to address to make sure that we're providing the highest quality of life. Yeah, I mean, we're going to close some streets probably at some point this summer, and you know, one of the things that has been fortunate here from social distancing is the weather's just been terrible, so it hasn't been sort of this huge pursuit of folks that are outside. But yeah, so I mean, I think that we'll begin to see it, and I think that, you know, from some of our micromobility things, I think we'll begin to see, like, you know, there's a way to sort of give people more options, and I don't think, so it might accelerate that a bit. But yeah, I mean, we're going to continue to be focused on sort of like how are we making sure we're providing the mobility to folks in the city that they needed.
Absolutely. Perhaps Álvaro could go next, and then I think if we take maybe 2 more minutes, if everyone will bear with us, and then we'll wrap up.
So I can talk from a transit perspective. I think we love what is happening with micromobility in cities, because transit normally is trying to meet different goals and different transportation needs at the same time. So all the things that are happening with micromobility right now are helping transit focusing more in the large distance trips, while the micromobility is focusing on cities in the short trips people can take. So this is another opportunity for transit agencies to save more money and put those vehicles where most people need it.
So I think it's also, to Mark's point, like within the pandemic, there's also a lot of suffering and a lot of there's a lot of needs to consider. And even as an advocacy organization, we sort of get pushback. Oh, why are you talking about bikes? Why are you talking about streets? Why are you talking? 5 weeks ago, when we started these conversations, we got a lot of pushback saying that where I won't use the language that was used, but the reason that I started off my presentation with things like food access and things like accessible testing, which has sort of been core to our advocacy since even 5 weeks ago, is mobility really plays a vital role. And people are legitimately scared of returning to public transit. And we can talk about the debate around that, but people still have that fear. And it is a really important thing for cities to recognize that, one, a lot more people are walking and biking right now. 2, it can lead to a much more sustainable future. And 3, it has real impacts on people's access to things like testing and food right now. And as transportation professionals, we need to make sure that we see the intersections of these worlds happening right now and make sure that, speaking of resilience, that we come out of this stronger and better prepared for whatever is going to hit our cities next.
Thank you so much, all 3 of you, Álvaro, Caviedes, Azhar Chougle, and Mark de la Vergne, for your presentations today and for sharing your wisdom with us. Also, thank you again to our co-hosts. You can see their information on the screen. Make sure you're following all of us on Twitter to hear about the next webinar in the Resilience and Transportation series, which we think will be happening in a couple of weeks. Thank you so much, everyone. Thank you for bearing with us during the technical difficulties. Have a wonderful day, and please stay safe and well.